Hair loss, skin rashes, wound healing problems. These are some of the symptoms of zinc deficiency. In this video, we'll look at 10 symptoms of zinc deficiency. Coming up. I'm Dr. John, board certified in internal medicine as well as geriatric medicine, and in this channel we'll give you tips and advice to keep you young. What is zinc? Zinc is a nutrient. In fact, zinc is referred to as an essential nutrient as your body is unable to produce it. You'll have to get it through dietary means, that means through your food. Why is zinc important? Zinc plays an important role in a variety of functions in your body, such as promoting your immune system. It can help reduce infections such as colds and pneumonia. Wound healing. Zinc is important for your skin. DNA synthesis, protein synthesis, growth and development during pregnancy, as a child and in adolescence. Zinc also plays a role in your taste and smell function. Zinc helps with your eye health. How much zinc should you take in with your diet? The recommended daily intake in your diet per NIH is 11 milligrams for men and 8 to 9 milligrams for women. Zinc can be found both in animal and plant sources. Here are some examples of foods and the zinc content in milligrams per serving. Oysters cooked, breaded and fried, 3 ounces, 74 milligrams per serving. Lobster cooked, 3 ounces, 3.4 milligrams per serving. Baked beans, 2.9 milligrams per serving. Chickpeas cooked, half a cup, 1.3 milligrams per serving. Here is a list of foods which are good sources of zinc. Red meat such as pork, lamb or beef, shellfish such as crabs, and in particular oysters, legumes such as lentils, beans and chickpeas, seeds such as pumpkin seeds, squash seeds or sesame seeds, nuts such as cashews, peanuts or almonds. Nuts have an added bonus as a good source of healthy fats and fiber. Dairy such as milk or cheese, eggs, whole grains such as oats or rice, certain vegetables such as green beans or potatoes, and even dark chocolate. And if you're interested in another supplement called vitamin D, check this out. Risk for zinc deficiency. Vegetarians, pregnant women, individuals with GI diseases such as Crohn's disease or ulcerative colitis, individuals after GI surgery, gastrointestinal surgery, if you have sickle cell disease, if you drink alcohol excessively. And if you're finding value in this video, don't forget to like and subscribe, as this really helps this channel out. What are some zinc deficiency symptoms? Zinc deficiency is rare. However, if you do have zinc deficiency, it can be caused by the following symptoms. Here are 10 you should be aware of. Impaired wound healing, skin rashes, chronic diarrhea, loss of appetite. If you're growing, impaired growth and development, hair loss, eye and skin lesions, taste abnormalities, impotence, mental fatigue. Can your healthcare provider test for zinc deficiency? Your healthcare provider will ask you about your dietary history, medical history, as well as complete a physical examination. Depending on this information, they will determine if additional testing is required. Lab tests which test for zinc deficiency are not reliable, as zinc is found in different parts of your body and not only in your blood or plasma. And even if your plasma levels are drawn, one must consider the state of inflammation you're in, whether it's acute or chronic, and also the albumin levels you have in your system. Zinc supplementation. The natural source of zinc is from your diet. If you need supplementation, discuss this with your healthcare provider, who can give you appropriate advice. Examples of forms of zinc which can be used as supplements are zinc sulfate, zinc acetate, or zinc gluconate. Zinc oxide is not recommended as it is poorly absorbed. Now, the upper limit of zinc daily should not exceed 40 milligrams daily. What are signs if you take in too much zinc? This would include GI symptoms such as nausea, vomiting, diarrhea, and stomach pain. You could even get headaches. If you're taking too much zinc with food and supplements, you could inhibit copper absorption. This can lead to copper deficiency in your body, resulting in anemia, affecting your immune system, and even reducing your good cholesterol called HDL. If you do take in zinc, take it at least 1 hour before a meal or 2 hours after a meal. Zinc supplementation can also interfere with antibiotics such as ciprofloxacin or doxycycline. It can also interfere with the absorption of penicillamine, which is used to treat rheumatoid arthritis. Diuretics such as hydrochlorothiazide can also increase urinary excretion of zinc. If you look carefully at the labels of some of the over-the-counter medications, zinc can be found in many of them, such as multivitamins, cold lozenges, nasal sprays, and some homeopathic medications. This is because, as I mentioned earlier, that zinc has been found to be helpful in fighting off infections. And if you're interested in other videos, click right here or click right here. Have a good day and think your health. What's wrong with this? Is this starting again? That's a wrap. Boing!